Hi, good morning and welcome everyone to County Executive Pittman's virtual press conference. This morning, the County Executive will share updates on the county's COVID response efforts, as well as a hiring event taking place at Severna Park High School later this afternoon. We'll take questions after the updates. As a reminder, please put your name and media affiliation in the chat. And I'll be calling on folks in that order for questions. And please keep your microphone and camera off unless you're called on to ask a question. With that, Mr. County Executive.
All right, thanks, Jeff, and thank you everybody for joining us today. I think it was 2 weeks ago after the council meeting, the county council meeting, I was celebrating the fact that most of the bills had passed 7-0 and that they had done good bipartisan work and kept national politics out of our local efforts to govern in Anne Arundel County. And last night was different. Last night was a shot across the bow that I think was letting me and our county know that, in fact, we're not immune to some of the most divisive and irresponsible public policy that plagues our country. We had a simple bill that was authorizing accepting $5.4 million in grants from the state of Maryland Department of Health to the Anne Arundel County Department of Health that was going to fund opioid intervention programs, 3 of those, as well as 2 for COVID prevention, particularly vaccinating children, and then 1 that was general support for the Department of Health. And I'm disappointed to say that Councilwoman Jessica Hare, Councilwoman Amanda Fiedler, and Councilman Nathan Volke all voted as a block against accepting this money. Now, fortunately, they did not get a 4th vote, but had they gotten that 4th vote, I'm going to read to you the programs that we would not have had funded in the county. And I'm doing this because I just think it's important to recognize that we are at risk in this county of having bad public policy pollute our efforts to govern in this county. And I do have a letter to Secretary Schrader of the Maryland Department of Health asking for some intervention here. But first, I just want to tell you what the programs are. There's $3.1 million for immunization and vaccines for children. There is $1.7 million for CDC Crisis Cooperative Agreement, also for COVID prevention, preparedness, response and recovery initiatives, including school-based health programs that are desperately in need of financial assistance right now. The Maryland State Opioid Response Hub and Spoke Program, $159,000 to get buprenorphine to people who need it, connecting with the primary care doctors. There's the Maryland Department of Health State Opioid Response Adolescent Clubhouse expansion for $122,000, expand services in 2 adolescent clubhouses for youth in early recovery and or at risk for relapse or initial use. These funds would offer enhanced life skills and substance use prevention activities. And then there's $131,000 for substance abuse prevention from the state, and then $100,000 for supplement to core local health funding in response to the COVID pandemic. And I was shocked. I know others were shocked to see these votes against it. So I have drafted a letter this morning to Secretary Schrader, and I'm going to read that to you. It says, last night, the Anne Arundel County Council came dangerously close to rejecting $5.4 million of state support for our opioid intervention and childhood vaccination efforts. Councilwoman Jessica Hare, Councilwoman Amanda Fiedler, and Councilman Nathan Volke, despite having been briefed by Dr. Nilesh Kalyanaraman on October 12th and having access to all supporting documentation, voted to send this money back to the state. Had 1 more council member joined these 3 in their position, the residents of Anne Arundel County would have been the only Marylanders without this important Hogan administration support for public health. My administration and our Department of Health have made repeated efforts to constructively engage these 3 council members in our efforts to save lives from both COVID-19 and the opioid epidemic. My hope is that hearing directly from you and your team, the direct representatives of Governor Hogan, will open their minds to the value of public health work. Please offer these 3 council members and any others who would like to participate a briefing on the importance of the funds that they voted to reject. The list of programs is attached. Thank you for all that you and Governor Hogan do to save lives in Anne Arundel County. So enough said on that. On a more positive note, we have jobs in Anne Arundel County, good jobs that not only support a family, but also serve the community. And today from 4 p.m. to 7 p.m. at Severna Park High School, our great team at Workforce Development is putting together a hiring event. It's got Anne Arundel County Public Schools, our Rec and Parks Department, and our Department of Health there, giving information, taking applications for some great jobs, bus drivers, of course, which we're recruiting actively for, and bus aides, food service workers, custodians, carpenters and general maintenance, mechanics, HVAC technicians, electricians, plumbers, grounds crews, IT support. I'll go on and on and on. Park rangers and park maintenance, those are not only great jobs, but they're fun jobs. So, and the great work at the Department of Health. So please come out. I will be there at 4 o'clock and welcoming folks. And you can actually go to AACPS. This will be in the comments on Facebook, aacpshiring.eventbrite.com for information about that event. So I'd like to pass it on to Dr. Kalyanaraman, who will give you an update on COVID vaccine for 5 to 11, boosters, and additional information as well. Thank you.
Thank you, County Executive. We'll start with where we are with the 5 to 11 year old vaccination efforts. So in our county, we've gotten over 7,000 kids have between 5 and 11 have gotten their first dose in the first week and a half, which is fantastic. That's nearly 14% of all the 5 to 11 year olds in our county. There's still high demand. We know parents want to get their kids vaccinated. The health department, pharmacies, pediatricians' offices, we're getting supply at various times, so there's always new availability being added. Just yesterday, actually, the health department made nearly 1,500 appointments available. So please keep checking, get your children vaccinated where they can. Remember, the vaccine is safe, effective, and free, and this is an important step in our recovery. Along that line, boosters, as we've talked about with some vaccines, your immunity decreases over time and you need a booster shot like we do with the flu vaccine or tetanus. And so we really want to emphasize that if you've gotten both doses of Moderna or Pfizer, we recommend that everyone 18 and older should get a booster shot if it's been more than 6 months after your second shot. As we're entering the thick of cold and flu season, it's important to make sure you've got that good protection. Really strongly recommended for people 65 and older, or 18 to 64 with chronic health conditions, high-risk work settings, or high-risk living situations. In fact, if you're in those two groups, you are likely one of the first ones to get the shot. So it's both been more than 6 months and you're at higher risk. It's really important for those groups to particularly get their booster, but I do want to emphasize everybody 18 and over should get their booster. If you've gotten the Johnson & Johnson vaccine, everybody who's gotten one shot should get a booster 2 months after their first dose. That is everybody. We get a lot of questions around which booster you should get. It's most important to make sure you get a booster. Generally recommend you get the same one as your first set of vaccines, but that's not critical. You can switch if there's a reason to do so. And then want to make a plug for during the holidays. We know that folks can have some trouble with mental health issues, feeling sad, depressed, feeling disconnected. Remember that our mental health warm line is available 24 hours a day, 7 days a week, 365 a year. Their number is 410-768-5522. And then lastly, I do want to thank the council for passing the bill, allowing us to use the $5.4 million in grants from the Maryland Department of Health. Obviously, the money to do immunizations for and vaccines for children is a critical part. It's what we talk about a lot. And so it's going to allow us to fund the staffing and sustain our response around this. And just one piece of one of those grants, the Hub and Spoke, it's a program we don't talk about a lot. It really is a program to expand buprenorphine access through outpatient providers. And so it's really about building outpatient providers like primary care practices and other opioid treatment programs, building their capacity so that it's easier for people who need medication to be able to access it. And so this kind of funding is really important to build that network, continue to expand our response to opioids. So with that, I'll turn it back over to you, Jeff.
Thank you, Dr. K. And folks, as a reminder, please put your name and media affiliation in the chat. And I'll be calling on you in that order for questions. First up, Brian Sears, Daily Record.
This question for Dr. K. I want to make sure that I understood one of your statements about boosters correctly. It sounded like you were encouraging boosters for all adults 18 and older, outside of the CDC guidelines, which are currently 65, everybody 65 and older, or those 18 and older with underlying conditions or immunocompromised. So first of all, did I understand that correctly, that you're encouraging all Anne Arundel County residents 18 and older who are 6 months away from their second dose to go ahead and get a booster now?
Yeah, so I think there's been a lot of confusion as to who is eligible and who is not. We've been getting a lot of questions about that. So yes, we are recommending that pretty much everybody who's over the 18 is eligible and should get the booster if it's been more than 6 months since their second shot if they got Pfizer or Moderna. And part of that is that the folks who got those shots initially, particularly at this point, all have some sort of high risk, whether it's in terms of their age, health conditions, living conditions, or occupations. And even when we talk about what your occupation is, almost all of us are interacting with others on a daily basis. And so there is that consistent risk there. When we first started our response in vaccination at the beginning of the year, we had to make tough decisions as to who goes first and second. Right now, there isn't those tough decisions. Everybody can get access to one. So we want everybody to take advantage of that opportunity to protect themselves.
This is a step that has, I guess, goes beyond what the state's currently doing. Yesterday's Health Secretary Dennis Schrader told a Senate oversight panel that they were considering making this move, but hadn't yet gotten there. One of the concerns that they have is an issue that they ran into with providers earlier this year when they went outside of the CDC guidelines, who were concerned about providing doses that were not part of the CDC recommendations. What are you doing to encourage providers to go ahead and give those doses, even though the CDC is not providing that under guidelines?
Just to be clear, we are within the CDC guidelines. So we're not going outside of either the CDC or the state guidelines. I want to make that really clear. It's still only for people 18 and over. You still have to meet that criteria of being more than 6 months after your second dose for Pfizer or Moderna, or more than 2 months after your one dose of Johnson & Johnson. What we're finding is that when we talk to folks, almost everybody who, in particular in that 18 to 64 category, right? Almost everybody has some high-risk condition of either working or engaging with others in the community. And we're not finding a lot of people who are at such low risk that a booster wouldn't be applicable to them. So I think what we're trying to do is really clarify that people don't have to exclude themselves from getting a booster. That as long as you're eligible by age, over 18, and 6 months since your last Pfizer or Moderna dose, you are eligible. So I just want to make that clear to you.
So final follow-up then, what I'm understanding is that what the county is doing is expanding the definition of risk to include everybody who's sort of out there and already interacting 6 months after their second dose. That's where it seems to me like that's where the county is defining risk.
Yeah, we're finding that people are kind of thinking of that first January, February kind of moment in terms of how they define risk, and only if they're at the highest possible risk are they getting vaccinated. And what we're saying is we've opened up a lot, right? People are back at work, people are going out doing their daily activities, and there's a lot more risk. And so we want people to recognize that their activities will put them in that higher risk category.
All right, next up, Brad Bell, ABC 7 News.
Good morning. For the county executive, sir. You mentioned the hiring fair at the high school. Superintendent Arlotto wrote an op-ed in the Capitol this morning. He was speaking with some passion, asking for help in the community and talking about incidents of violence and in school and in buses. And I still tracking it down, but I gather there was an incident on a bus last week. And my question is, do you have any thoughts on that? Any words you'd like to share with the community as well?
Yeah, I agree with everything that he said. It was well said. And I think what he's saying and what I'm saying in that these are not only good jobs for you, but these are jobs that our community needs filled. And that by stepping up into one of these positions, you're serving the community. And some of those jobs aren't easy, particularly being a bus driver is not easy. And I know that the school system is doing everything that they can to improve working conditions. And but we need people to step up. I mean, I think that's exactly right. This is a time to step up and serve your community and enlist as a public servant.
You mentioned kindness, and behavioral issues. You too?
Absolutely. Yeah. I mean, I think that, we are one people. We are one community, and we have a lot to be grateful for. And we got a lot of work to do as well. I think we have a great team at Anne Arundel County Public Schools, and we have great public servants in all of our departments, and we want you to join us.
Thank you.
Next up, Rob Lang, WBAL.
Hi, good morning. Question, I'll go to Dr. Coloronimon, but the county executive may want to weigh in on this. You mentioned 14% of the kids 5 to 11 have received at least their first dose. I know you've been using elementary schools, a lot of outreach and everything like that. How big of a waiting list is there for parents trying to get their kids vaccinated? Because we've heard from parents, not just in Anne Arundel County, but in other jurisdictions, that it's hard to get an appointment. So how big of a problem is this in Anne Arundel County, and what are you doing to solve it?
That's correct. There are people who still haven't been able to get access to a shot. We're not keeping a waiting list. The real issue here is that as the federal government releases more vaccine, the pharmacies, the pediatricians' offices make them available. So the real issue here is just vaccine supply. And as we go on through the next few weeks, we anticipate that by the beginning of December or so, everybody who wants a shot should be able to get one for their kids.
And I know you've been using elementary schools too for vaccine clinics. Has every elementary school in Anne Arundel County been used in the last 11 days, or are you still some schools waiting to be used?
So there's about 80 elementary schools in the public school system.
Okay.
So our plan was to be at 24 of them, and then we're going to be working with the school system to identify additional schools as we go along.
Okay. Thank you very much.
Lily Price, Capital Gazette.
Hey, can you hear me?
Yep, we've got you.
Okay, great. Along the same lines as Rob's question, is there any effort from the health department to have mobile clinics or anything to address transportation and access for children vaccination clinics?
So that is absolutely part of what our thinking is in terms of being at the schools. We're also working through our health ambassador program. They're still out there in the community, and they're still able to get people appointments, help with transportation. And of course, we at the health department have been providing help with transportation throughout. So those efforts continue. And then as we get into December, we'll look at additional community sites like we had done with the adult clinics prior as well.
Having times in the evening, like the adult clinics, is that something you guys are discussing?
Yes, so we're definitely going to be having evening hours, weekend hours to make sure that parents can get their kids there.
Okay, thank you.
All right, last call. Any questions? Please put your name and media affiliation in the chat. All right, that'll wrap us up for the week. Thanks, everyone.